Cheers. Welcome to Coffee and Childbirth. Today, we are joined by this little furry thing on my lap.
We are. She looks a little guilty, to be honest.
Why do you look a little guilty? We have some backstory about what happened, but we don't have evidence of it, right?
Yep.
Those who know knows.
Yeah.
But today, let's go back to the podcast. We're going to be speaking about you today.
Thanks. PT.
Yes. Physical therapy.
Yeah.
Yes. And, honestly, how all of that came about for you and how you ended up here. I would love to know more about your side of the practice.
Sure. What it looks like in a visit, that kind of stuff.
Yeah. Well, I would like to know more about physical therapy world, actually.
Mm-hmm.
And then I would love to know more about how that looked for you, like your credential, how you came about doing what you're doing now, and kind of, schooling and what it looks like to be a physical therapist outside of private practice, because you've done both now.
I have.
And so I would love to know more about that. So Dr. Kelsey, take it away.
Thank you. So my name is Dr. Kelsey. I'm a board certified doctor of physical therapy. And this is Dr. Justine Rhee. So if you're joining us for the first time, we are chiropractor and physical therapist by trade, but we do quite a few things differently or some similar to the basics. But so what it comes down to when kind of how I arrived here and having a private practice or in the population that I serve, being specific to this population, is I went to undergrad up in Northwest Washington area, Seattle area, Bellingham area. And then I went to grad school in San Diego, actually.
I did not know that.
Yeah. So San Marcos technically is the city, but like 45 minutes north of San Diego.
So you were a beach girl just like me for a little
I was for a hot minute, and I really liked it. But beach girl life is expensive.
It is.
So I became again a desert girl or a non-beach girl that visits, because that was So So I went to undergrad in Washington, went to grad school in San Diego area. My husband is in hospitality, and so there was like kind of a mix of where he was finishing up school. That's how we ended up here in Vegas.
Gotcha.
As far as my first job was technically here, seeing adults and some kids, but mostly seeing adults at an outpatient neuro, like an outpatient vestibular clinic.
Okay. Oh,
I think they're still around.
Okay.
Physical is the name of it.
So you didn't see that many kids.
I didn't.
There.
I was the only one who saw kids.
Oh.
Because I left school knowing that I wanted to work with kids.
Gotcha.
So I liked pediatrics. I helped with point lab or like pediatric lab in school. I wanted that my rotations to be there. Oh. So I knew that was where I was going to start or eventually land. It was not an awful experience.
Okay.
It was
that's good.
Neutral, like first job out of school, third party payer insurance system. So lots of high volume.
Okay.
I was the only one treating kids. So any of the kid referrals, I would see like one baby, and then I'd see like a teenager, and then I'd see
so all ages of pediatrics. I see.
Elementary school with a neuro specific diagnosis like cerebral palsy. So I'd see like a whole gamut of the pediatric population, which wasn't bad, but I was like, oh, this is not necessarily what I was envisioning or thinking. And when you're right out of school, you don't necessarily even know what that is.
You don't even know what your name is.
You don't even know what your name is.
Like what letters go behind your name.
Taking blood pressure. It's like kind of a mess.
Right.
You're like, I'm so excited. But you're also just clueless.
Yeah.
So started in that setting with my basic degree, my doctorate degree that got me, licensed and not hurting anybody. It's like, that's what they always said. It was
yes.
That's what we send you out of school is like, just to not hurt anyone.
Yeah. Don't kill anybody. Don't hurt anybody.
Yeah.
Don't get to a point where you're using your malpractice insurance.
Yeah. Like all is, that kind of stuff. So it was a lot, even without kids. So we were engaged.
Oh, because it was just you and Phil.
It was just me and Phil. So we were engaged and then married eventually after that time. We were married when we were back in Seattle, actually. So
gosh, so you came here.
Yeah. So first job was here.
Oh.
And then I decided, I don't think this is the right setting. It's an okay setting.
Yeah.
I don't think I'm going to last here.
But Phil came
for my entirety of my
Phil
career.
was here with you.
Yeah, because he was finishing up his UNLV degree.
Got it.
So he was finishing up his hospitality degree, and I had started out, and we were just starting out. And so then when he was done with his degree, which wasn't very long, I was only there for a year. Like we were only here for a year. There was a friend of mine from PT school that actually knew Phil, oddly enough, but also was back in Seattle, and she was working for early intervention.
Okay.
Only early intervention. And she was like, hey, I know you like pediatrics. Do you want to come work with me for the, with this position? There's an opening. There's only one of me. She was serving an entire 2 counties.
Okay.
Large distances, all that stuff. And she's like, I need help. She's like, I know you're a good clinician. I know we work well together because we worked in school together on projects and stuff.
Yeah.
And I was like, yeah, actually. I was like, I know it's a move, but this is only pediatrics.
Yeah.
It's only birth to 3.
Gotcha. Did you already know at that time that
I knew that I wanted to do pediatrics, and I knew I wanted
young pediatrics.
I knew I wanted to do young pediatrics.
Okay.
I was questionable on older pediatrics.
Yeah.
I knew I wanted to hang out with babies. I was way more scared or intimidated by teenagers and older
interesting. Okay.
And so we went back to Seattle. I was like, let's do it. We're engaged. We're going to get married in Seattle. Let's just do it and take this time. And I found that I really liked early intervention, the birth to 3. I was like, this is great.
Yep.
Why aren't we seeing birth to 5 was my first question. Because what happens in early intervention, I think in any system that's only seeing birth to 3, is that kids drop off, they age out at 3.
Yep.
They're in pre-K.
Very much so.
And then they have no tools or very little tools when they enter kindergarten.
Yeah.
Now, after having kids and understanding how very much variability there is with school options, I'm like, oh, I guess it's not that bad, because there's kids who could be homeschooling. There's kids who could be in different scenarios, and they maybe would.
I feel like that's more apparent that I'm here. I moved here.
It's more commonplace.
Yeah,
here.
For sure.
But at least those kids, maybe their parents are used to designing their curriculum, accessing resources for them, so they won't necessarily fall through the cracks.
Gotcha.
Which is what I realized. But the majority, I don't know what the stats are, the majority of U.S. kids are not doing that. Right. So those kids are going into a regular school system, then at kindergarten, and there's really, maybe they had some stuff going on in those early years, but they're told, and their parents are told, oh, they grew out of it. They don't need support, which we know is likely not true. So I decided at that point, okay, I really want to treat birth to 5. How would I do that?
Well, I don't want to cut you off, but I don't know if you remember this when you were really young. You're probably very young at that time. I still remember
What year?
What year is this? I mean, I was very young, so you might actually not have been on this live. But there was a huge campaign that they called it the First 5, right? The First 5 was a big campaign that was going on. I think it was called First 5 or K to 5 or something like that. So it was a campaign about how important it is for children to have certain types of, I don't know if you want, I think it was education and community and support. But it was a government campaign. And I think it was through the Department of Health or Education. I can't remember. But I remember seeing billboards growing up as a kid. And I remember that, I guess the first 5 years of human life must be very important for some reason. I just remember thinking that. And obviously fast forward now, you and I both understand that development, that neuroplasticity in our brain and how it develops, physical therapy and chiropractic wise too. That first 5 years, I think when you hit past the 5, it's much more different in the way kids learn and the rate of learning. And so setting the right tone, that first degree of change, as people say, I think it's that first 5 years, but really, really, really important.
So the campaign sounds kind of familiar, but now I'm curious.
I have to look it up.
Google it because I want to know what.
Yeah, I'm going to have to look it up too.
But to your point of percentage of brain growth, percentage of jaw development, percentage of those things is exponentially higher within that birth to 3. Because so there's like the Pathways organization is, as far as that maybe is like more of the longer standing option for all of that education to go, because I believe it is government based, where all that kind of lives. Yeah. So at that point, I didn't have kids yet. We were just married at that time, but I was like, I know I like birth to 3. I like birth to 5. This is really where I want to be. I was very confident about that.
And this is much after you were done with school, right?
It's like 3 years in, maybe. Yeah. It was not in retrospect, I'm like, nothing. But yeah, I mean, it was like after people would have like established kind of in the first 5 years when you're establishing where you're going to be with your practice. Like, are you a hospital setting person? Are you, where are you going with that?
So then when you're in physical therapy school, and I genuinely ask because I really don't know. Yeah. I only obviously have a understanding how curriculum works for chiropractic school, but also I understand it from a medical school because we're always compared, medical school, chiropractic school, curriculum-wise, what we study. And then my very, very good friend back in the day, she went to med school at the same time as I went to chiropractic school. I always felt like there's comparison of what she's studying versus what I'm studying. So I'm kind of curious with physical therapy because I don't know that side, like curriculum-wise, then how did you get the education or information about pediatrics work within physical therapy? Was it part of a lot of the curriculum in school while you were in school, or was it after you graduated and you had to seek that kind of information and education thereafter? Like, what was that like?
For specialty wise, or just general? So specialty wise, it was very general in PT school. I also went to I went to through a program, a Stanley Paris program that was manual orthopedic based. So kind of more of like the ortho bro world.
I know that too as a chiropractor.
Yeah, yes. I borrow that from Nicole Cozine, Dr. Nicole Cozine, who's a pelvic health therapist, physical therapist, and she has, I hear that a lot. I went through her mentorship, and it's like very accurate. And I love the ortho bros that I went to school with.
They have their own space.
I still like, they're fun.
Yeah, chiropractors
brilliant,
too. Ortho chiros,
yeah. But that was the program kind of directive. So a lot of focus on manual treatment, a lot of focus on movement, but very much like technical skills where you would use your mobilization, you would use your manual skills first. Got it. So neuro was obviously part of our curriculum and what we learned about neurology, of course, how all of that motor control planning, all of that stuff.
So Parkinson's, motor and sensory nervous system.
Yeah, motor and sensory, because we were actually the program dovetailed with OT. So we would start off, the OTs and the PTs would go together and start off with anatomy classes were taken with OTs. There's a certain amount that was taken with OTs, which I really loved. I love my OT ladies probably
of course,
because I would hang out with them outside of class
with me.
And that kind of stuff. So, and they sometimes would be like, "Oh, you're Chelsea from OT," and I'm like, "No, I'm Kelsey from PT." Like, let's not get it twisted here. But so anyway, so that type of curriculum was pretty general. And we were looking at your classic like back pain. You do this.
Gotcha.
Which in hindsight. There isn't really, in my opinion, a great pediatric physical therapy like program. There's maybe like
in general.
There's maybe some residents,
even all other schools besides the school that you went to.
I haven't heard of like, you go to ASU for peds. You go to UW for.
It's the same with chiropractic. Actually.
Yeah, so I don't think, and I would love if there's one out there. I'm so curious, but. At least when I went to school, there wasn't. And I didn't know to look for that. So Pretty general, a lot of the neuro type of approaches that I remember learning, then and utilizing as a jump off point were what I used in peds and definitely in pelvic health.
Okay.
So I started off in peds, fast forward through, I went through a hospital program, hospital outpatient, because it gave me the best of both worlds.
Okay.
I got to see kids in clinic for 2 days a week, and then I got to see kids out in their homes.
That's great.
So I could do both.
Yeah.
I could bill early intervention services. I could bill private insurance. I was able to navigate these two worlds. Okay. It got me exactly what I wanted. It was a great place to start and realize like, oh, wow, I could do both of these and the flexibility is here.
Yeah.
I tried to start a program there for moms and babies because the floor that we were on in the hospital, ground floor, was the children's wing.
Okay.
And it was part of what's called a women and children's center.
Oh.
Which I was like, duh. Like, why are we not treating women and children? Because they had delivered babies 4 floors up.
Yeah. Yeah.
Sorry, it's still a little like irritating to me because I like
there's a little bit of just bitterness.
Why are we not doing? Why are you not sending a
frustration
PT up?
Yeah, it sounds
to
like
this literal. There's a NICU up there.
Yeah,
I'm like, come on.
Yeah.
So,
well, I think this is just in general of just the medical world. It's very compartmentalized.
Yeah, and
so they don't talk to each other.
Yeah. It was a health system, hospital health system, which is very siloed, all of that.
Yeah. Oh my gosh, siloed.
But I was
great show, by the way.
Green.
Sorry.
I was like green and young and like, let's do it.
Yeah.
Like, we can do it together.
Yeah.
So I tried. There was a PT, amazing PT there who, she's Lori is her name. She'd been there for like, shit you not, 30 years, 20 years.
Wow.
Long time.
Survival,
so she
man.
knew all of the ins and outs.
Sure.
And she's like, yeah, I tried to start that like
it wasn't
15 years ago.
Receptive.
And we weren't really, it was hard.
Yeah.
It didn't work. And I was like,
when you're in a system.
And I was like, oh, we can do it. Blah, 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 like an idiot. And then, like I said, love my boss, love the team there. They were great. It just wasn't. They didn't say no.
System,
they didn't say no, but it was going to be glacial.
Yeah.
And they were like, why don't you just give some exercises before you leave the baby visit?
Yeah.
Give the exercises to mom. And I'm like, that is not it. I'm not doing that. But thank you for your input. And so specialty wise, I said, after I had my first son, I said, oh, this is what I am supposed to do. I was like, this is why I lily pad leapfrogged from one population setting to the next one because it really literally gave me the confidence to be like, oh, that's what I want, that's what I don't want, that's what I want, that's what I don't want. It's
almost like a filtration of things that you feel like it's organically drawn to. It feels natural. It feels right. Yeah, I get that.
So that's where, with specialty, continuing education, all of that is something that had to be supported outside of post school. Like I said, they make sure that we're legit enough to not hurt anybody and do good, maybe not excellent, but do good care. And then you have to bring it upon yourself to go into those populations. So at that point, when we moved to Vegas, I had said, okay, I'm going to start this, but I want to know what the lay of the land is. I need to understand the agencies here. And so I didn't truly start the private practice, like burn the boats, go fully into it until my second was born and I came back from maternity leave.
Got it.
I was like dabbling, I was building connections, was doing a side hustle. And then when Hudson went back to daycare, we restarted the normal working process after maternity leave is when I said, okay, this is my chance. Either I'm going to go back into the system or I'm going to not. And I'm going to take that because I've learned